changes we've seen in joint replacement over the last 50 years are actually quite staggering. It's hard to imagine that a little over 50 years ago we didn't even have hip and knee replacement surgery. And at that stage, where it was available, it was only in very isolated parts of the world. Now, hip and knee replacement is a very common operation. It's life-changing. It's able to take patients with debilitating pain and make them much more mobile and functional in society. The other big change has been in rehabilitation post-surgery. Many years ago, when joint replacement was first introduced, patients were in bed for a couple of weeks and it was probably 3 weeks or more till they went home. Today, they walk the day of the operation and they're home within 2 to 3 days. So we really have seen a revolution in the way joint replacement is changing people's lives. The Mako robotic system was introduced into Australia some 5 years ago, and St Vincent's Northside's been at the cutting edge of this surgery since its inception. We were the first centre to perform robotic total hip replacement in Australia, and we were one of the early pilot sites for the implementation of the total knee platform. Robotic surgery allows us to implant our components much more precisely. We're able to plan the operation ahead of time. We're able to change the orientation and positioning of our components during surgery depending on the situation we encounter. And once we've formulated a plan, the robot will either ream, cut or burr the bone incredibly precisely to allow us to position the components very accurately. This has led to patients being more mobile more rapidly. It's led to decreased pain post-surgery, and in certain instances it's already showing that the revision rate for these implants has been decreased. The future of orthopaedics will be much like the future of medicine. It'll be more robotic, there'll be more big data, there'll be more machine learning, and there'll be more artificial intelligence. We'll better understand each patient's pathology and anatomy, and we'll be able to more precisely tailor our implants to a specific patient. The robots will become more autonomous, and I imagine they'll perform more parts of the operation than they currently are assisting us with. Currently, the robotic platforms are mostly around hip and knee replacement surgery, but with time they'll evolve into spine, into trauma, into shoulder, and probably most orthopaedic procedures where we're resecting bone will be done with some form of robotic assistance.